Doctors in the U.S. leaving medical school often face an overwhelming amount of student loan debt, and that can sometimes influence where they decide to work. I'm Renee Ng, and I'll share more about a program to give doctors some financial relief while also giving them the chance to serve in underserved communities. Every day, Dr. Jean Ann Delgado sets out to help some of LA's most vulnerable.
What you looking at?
Delgado is a pediatrician at an Altamed clinic in Boyle Heights, serving a low-income community. The Atlanta native started the job a few months ago and says her love of science and working with children set her on a path to medicine.
You know, when parents are a little distressed, it's kind of like the kids who are giving everyone the hope to move forward, and I really like that aspect of pediatrics.
But getting to this point took many years of schooling, leading to massive student loan debt, over $300,000.
8 years of schooling. I did a 1-year research fellowship, and that's, after a minimum wage residency and a minimum wage fellowship as well.
The average medical school debt is about $200,000 in the U.S. According to the Association of American Medical Colleges, that alone can influence a doctor's decision to work in primary care for underserved communities or pursue high-paying specialty care. According to John Backus, CEO of LA Care, the nation's largest publicly operated health plan.
There are medical deserts, as we call them, throughout Los Angeles County where there's a high concentration of Medi-Cal members, but the ratio of doctors available is not manageable, and people have to leave their community to find it.
So LA Care invested $2 million this year into its provider loan repayment program to help relieve financial stress facing doctors. It covers up to $180,000 of med school debt if a doctor works in an underserved community for 3 years.
There was anecdotal evidence that if a doctor spends 3 years in a safety net practice, that they become entranced with the idea that I'm really doing some good work here. These people really need me.
And those community clinics do, especially in the Medi-Cal network, which is severely underfunded and doesn't reimburse doctors enough, says Backus. Delgado says she's less stressed after the grant covered $150,000 of debt and getting better acquainted with patients who have welcomed her with open arms.
I've only been here for 4 months, but already half my appointments are with people I'm familiar with. They live in the neighborhood, they come back, they talk with you, they share their feelings.
And she can focus on doing what she loves.